In clear NEET, I know this result can really hurt. For years, you may have imagined yourself wearing that white coat, and today it may feel like that dream has stopped. But listen carefully. NEET may close the doors into MBBS this year, but it cannot close every door into healthcare, because healthcare isn't just doctors anymore. It is AI, it is software, it is medical devices, it is hospital technology, it is data that can save lives. So maybe the real question is not just, can I become a doctor? Maybe the real question is, can I still help people heal? Can I still build something that saves lives? Can I still make an impact in healthcare? The answer is yes, and to understand that, we have to first understand a very important thing. NEET is not the only door into healthcare. To understand how tough NEET is, we don't even have to know the seat numbers. Just look at the scale. In 2025, around 22 lakh students appeared for NEET UG. In the same year, around 14.75 lakh unique students appeared for JEE Mains. That means NEET has almost 50% more students in the race than JEE. So if NEET did not work for you, it does not mean you're not intelligent, it does not mean you're not hardworking, it does not mean your interest in medicine was fake. It only means one brutal narrow entrance route did not happen. For years, when you thought about the medical field, probably only one image came to your mind. White coat, stethoscope, hospital rounds, MBBS. But healthcare is much bigger than that today. Hospitals definitely need doctors, but they also need diagnostic software, patient monitoring systems, health data platforms, medical devices, AI tools, hospital automation. So if MBBS did not happen, the next question is, where can a student with interest in medicine actually go? There is a hidden door. MedTech, HealthTech, AI in healthcare. Okay, what do doctors and hospitals do every day? They read X-rays, they study reports, they monitor patients, they try to detect diseases early, they make decisions under pressure. Now imagine this. What if software helps them do it faster? What if AI flags abnormal patterns much earlier? What if data helps doctors make better decisions? And that is already happening. Cure.ai, an Indian healthcare AI company, builds tools for tuberculosis, lung cancers, and stroke risk. Reuters reported that their tools reach around 15 million patients annually. Niram AI uses AI and thermal imaging to support early breast cancer screening. Dozy uses AI-based patient monitoring to track vitals and give hospitals early warnings. SICTuple uses AI, robotics, and microscopy to support pathology diagnostics. But notice this carefully, these are medical problems, but they are being solved using computer science. So the next obvious question is, why does healthcare require computer science students? That is because modern healthcare runs on data. X-ray data, blood report data, heart rate data, medicine history data, hospital queue data, doctor note data. Biology helps you understand the human body. Computer science helps you turn that understanding into usable tools. Tools that can detect, predict, organize, and can scale healthcare solutions. And in this era, just knowing one field is not sufficient. Students who can straddle two different fields can actually be a lot more successful. David Epstein said something similar to this in his book Range. In complex and unpredictable fields, people with broad multidisciplinary knowledge often perform way better. And healthcare in AI is exactly that type of a field. You already understand biology, and now if you can learn AI, you can work in medical imaging. You already understand patient care. Now if you learn software, you can build hospital systems. You understand disease patterns, and now if you learn data science, you can work in health analytics or bioinformatics. And that is why Bio-Maths or PCMB students have a huge advantage here. And your biology background is not wasted. You already understand the medical side. Add coding, logic, data, AI, and product building into it, then you can stand at the intersection of medicine and technology. That intersection is where the next biggest impact on healthcare can happen. But the next practical question is this just interesting, or can this also become a strong career option? Imagine a hospital with 10 doctors. To support all these doctors, just white coats aren't enough. Strong systems are also needed. Software to manage patient records, AI to flag abnormal scans early, dashboards to track patient vitals, tools to reduce paperwork, apps to help patients follow medicines, data systems to help hospitals make faster decisions. So the future of healthcare will need more than doctors. It will need medical AI engineers, health data analysts, clinical software developers, bioinformatics engineers, medical imaging AI engineers, digital health product managers, health tech founders. A doctor may ask what is happening inside the patient. An engineer may ask, how do we build a tool to detect this early for thousands of patients? Both questions are similar, both can save lives. So don't look at B.Tech CSE as a random option just because you did not get NEET. If you choose it with clarity, it can be a powerful gateway into healthcare which can create impact. But this path may not be for everyone. So the natural next question is B.Tech CSE the right choice for you? Before choosing CSE, be honest. Don't just pick it because people say that software jobs pay a lot. You need logic, you need maths, you need coding. You also need the mindset to break down real issues patiently and solve them. You need the readiness to keep sitting with confusing errors and continuously attempt to fix them. If you are a Bio-Maths or PCMB student, B.Tech Computer Science is definitely worth exploring. But if you are a PCB-only student, please check the university requirements thoroughly because most B.Tech CSE programs require mathematics. And if your healthcare interest is still alive, start building towards it right from the first. A medicine reminder app, a hospital queue system, patient vitals dashboard, a basic medical image AI project, a clinical record management tool. That is real proof, and that is why programs like Kalvium are worth checking for the right student. In Kalvium's B.Tech CSE path, students start building real software from day one. They don't just learn computer science engineering through theory, they learn it through practice.
India's only Gen AI powered B.Tech CSE. No more boring lectures. Top executives from tech companies have come together to craft a B.Tech CSE where 80% of your time is spent on practical learning starting from day one. And paid internship opportunities in top tech companies before you graduate. India's only industry driven B.Tech CSE now available at 25 NAC A+ universities across the country.
So, if you are a biomath student who wants to solve medical problems with technology, don't look at this as a neat backup. Look at this as a possible new route. Check for your eligibility, talk to a counselor and understand the fit. Because the real question is not how do I escape this result? The real question is how do I build my next path with clarity? NEET can close one door, but it cannot close your entire future. Some people wear the white coat, some people build the AI behind the diagnosis, some people treat patients directly, some people build tools that help doctors treat patients better. So if NEET didn't work out for you, don't lose hope and don't think your dream is over. Maybe it's changing shape. Medical impact does not have just one door. NEET was one door, but it was never the whole building. And to help you check if this alternate path is the right thing for you, we have created a small quiz. And based on your answers, you can truly understand if this is the right path for you. The link is in the description. Use it before you take your next step.